Hi friends, in this video we will be dealing with 5 questions related to musculoskeletal system. The first question is, as a nurse, what should you first assess when you are admitting a client with fractured extremity? We'll see what the options are. The correct answer to this question is option 3. The area distal to the fracture should be first assessed for any neurovascular compromise. The nurse may also assess the opposite extremity for a baseline comparison, but the priority would be assessing the distal part of the fracture for any neurovascular compromise. Now moving on to the next question. For a client on heparin, the activated partial thromboplastin time is noted 95 seconds. The nurse should make sure the client is prescribed for The correct answer is option 1, protamine sulfate. It's to reverse the effects of heparin. Protamine sulfate, as you all know, is the antidote for heparin. And the other options like vitamin K is the antidote for warfarin. And the packed blood cells are usually administered to increase the hematocrit. Now moving on to the next question. A client with fracture develops compartment syndrome. Which sign should alert the nurse about organ failure in the client? The correct answer is option 4, dark and scanty urine. In compartment syndrome, myoglobin released from damaged muscles into the circulation can be trapped in renal tubules, and it can end up in acute renal failure. As you all know, crackles are an indication for respiratory complication, jaundice for liver failure, and generalized edema might indicate heart failure. A client with a spinal cord injury is experiencing blurred vision and a blood pressure of 205 over 102 mmHg. What should the nurse do first? The correct answer is option 3. Check client's bladder for distention. The nurse should immediately evaluate the client for bladder distension and be prepared for catheterization. Because client is experiencing autonomic dysreflexia, which is a medical emergency. So when considering the other 3 options, evaluating the client for bladder distension would be the nurse's priority. Just after a total knee replacement surgery, which finding should lead the nurse to suspect possible nerve damage? The options are The correct answer is option 1, numbness. Numbness could suggest neurological damage, but the nurse should make sure she also assesses for the 5 P's: pain, pallor, pulselessness, paresthesia, and paralysis. When considering the other options given, numbness should suggest neurologic damage. Thanks for watching the video, and if you find it useful, Please do share with your friends. Thank you.